our keynote address that was taken, please do want to pen them down. Let guest speaker will be more than willing to address those questions. Please a round of applause for the Baptist community.
So the unique trip dancers will be dancing for Osman. If you feel like joining them, you can come out and you can also shake your body in the Benin style though, in the Benin style.
Let's give them another round of applause again. That was very beautiful to watch and entertaining. As you can see, they actually adorn the red coral color, which is synonymous to identity in the Dostik here. As you must have seen also, our buses are coded in that color. So we particularly wish to also welcome you and encourage you as well to interact with as many persons you see to get the best experience of the state. Okay, could we please just outcry your jerseys as we rise? The Honorable Commissioner will please let's also encourage him by a round of applause. Thank you, sir. Pleasure. Okay, like I said, if we have questions from the last lecture we took, please do well to pen them down and send them across. Our speaker will do well to respond to them appropriately. Join me welcome Dr. Omoike Isegbe, representing the Executive Secretary, Edo State Primary Healthcare Development Agency, for his address. A round of applause, please.
Good afternoon, everyone. I would like to recognize the immediate past president, World Medical Association, our leader, Dr. I also like to recognize the keynote speaker, my teacher. I was wishing that the lecture would never end because I was just enjoying everything you were saying. Thank you very much, man. My leader, Dr. Harrison Omohua, the Deputy Chairman, Edo State NMA, Dr. Benson Okwara, you're welcome. I would also like to recognize the leadership of the NIMSA, the NEC, and the members of the NIMSA. I would just like to say that we are so impressed with what you are doing at NIMSA. My Executive Secretary, who is unavoidably absent, because as you heard the Honorable Commissioner say, that the state government will be launching over 10 primary health facilities in the coming weeks. He's currently in the government house with a meeting with the governor to finalize that plan. He sends his goodwill and wished he could be here today himself. So I would like to commend you for the work you're doing and for the insight for even having these topics as your keynote and something for your NEC meeting. So I wouldn't want to go over what my teacher had already said as primary health care. So I would just want to briefly talk about how we can create a sustainable primary health care with safe and efficient patient-focused services. We all know what primary health care is, and we know that for any healthcare system to thrive, for universal coverage to be possible, we need to strengthen the primary health care. The primary health care is the first port of call for citizens. That is where their entry into the health system. Like the Honorable Commissioner said that every ward is supposed to have at least one primary health care facility, so that within walking distances, people can access care in those places. So creating a sustainable primary health care with safe and efficient patient-focused services is not just the role of government. You know, over time, we've seen people insinuate that, oh, the government hasn't done this, the government hasn't done that. We all have a role to play in it. From private sector, public sector, to community members, to academia, to different donors, NGOs, we have our role to play. Now, in Edo State, what we have an initiative that we have started. We call it the STREAM initiative. Now, the STREAM initiative is an acronym. So the S means, like Dr. Moreno was mentioning, that sometimes you can just have buildings all by themselves with nobody there to attend to the clients. So the S there stands for staffing. So we have seen that the need to ensure that appropriate and adequate staff are employed to deliver the services in this case here, not just buildings, not just beautiful buildings and equipment. So in the past 2 years, the state government, the Edo State government, has gone on the massive recruitment drive. And from what I gleaned, because of some of the people that come for this interview, we keep wondering if such other interviews are not going on in other states, because we get people from the east, from the north, from the west coming for the interview in Edo State, and a lot of them are taking, even this year, 2 employments of staff are going to happen before the exit of this government, which is uncommon for governments who are facing elections. You understand? So one has already been conducted, and the staff bent down already, just awaiting resumption. So beyond staffing, the healthcare professionals who are staffed, from the community health extension workers to the community health officers to the doctors to the nurses and all those who work in the primary healthcare facilities, they ought to be trained and retrained, because the world is not static. There are a lot of things that are currently operational now that were not operational in the past few years. You know, now we talk about AI, we talk about a lot of treatment modifications. So training, consistent training, and you know that this goes on very regularly in the state. So that's one of the ways for creating sustainable primary healthcare systems anyway. So the T in the STREAMS initiative stands for technology. So we ensure that we use technology, we leverage on technology to be able to harness data, because data is what we require to guide our policy changes and innovation. So just now, for all the health facilities that the government is renovating and building, and trying to correct the disproportionality of the spread of PACs that were influenced previously due to maybe political leanings and all those. The government is building facilities in every ward and ensuring that those facilities are equipped with internet connectivity, with laptops and digital gadgets that we need to harness patient information. Even the community health extension workers who were previously manning these facilities are now being told what their role is, how often they should, how long they should spend in the community, how long they should spend in the facility, and because we are having more senior health workers like the doctors and the nurses, more of them employed to manage the healthcare facilities. So most of these community health essential workers are being given tablets to go into the community and get health information, as you get household records. So by the time we have the household records of the various community members, we can tell who we need to reach out to. If there are children, a number of children in a particular community, we can tell that, okay, we need to take immunization outreaches to a particular community. We need to carry out this function in this community. We need to carry out the other function. We need to have a medical outreach in this community. We need to intervene based on the records that we are going to harness from the from the various communities. So that's not exhaustive, but I wouldn't want to take much of your time. So the arrow is for rehabilitation and remodeling of the facilities. You will agree with me that you need to have a sane environment to be able to take care of people's health. And like the Honorable Commissioner said, that the previous insinuation that primary health care was for poor, rural, illiterate people is no longer there. If you go into the new remodeled primary health care facilities that we have now, you probably will think you are out of this country, and we would expect that nobody will feel belittled or ashamed to receive care in such facilities. The governor's goal is that any facility he cannot use is not good enough for low people. So, so the facilities, the primary healthcare facilities need to be built to standard. There's a standard prescription for how the buildings should be, how many beds should be, depending on the level of the facility. And then beyond renovating these facilities, they are being equipped with all the medical equipment that they require at that level. So when patients come in there, they don't say, oh, they don't have beds, or they don't have blood pressure apparatuses, or they don't have different gadgets that they need to get care in that facility. So, like I started, I said the staff need to be there, they need to be trained, the technology needs to be there to be able to get data from these patients and keep appropriate records. So, like the Honorable Commissioner was saying, that we are phasing out paper from our facilities and our offices. So, and then talked about renovation and equipping those facilities. Now, then we're talking about the E. E is we're engaging stakeholders. We ensure that we engage all stakeholders. You know, because by the time you have all these facilities available and people don't know about it, they probably will not be able to use it. You know, from the community to all the other people who have a stake in primary health care, we ensure we engage them at the various levels to be sure that they know about these systems improvement measures that we are taking, so that they can also cascade this down and ensure that these facilities are utilized. Because if these things are there and people are not aware about them, then we cannot really say we are building a sustainable primary health care system. So then the M is management system. So in management systems, we ensure that we strengthen the processes that happen in the various facilities. We ensure that the quality of care that people can get anywhere in the world for primary health care is also what they can get in this place. So we set up standards that are to be followed in every place, monitoring and supervision to ensure that these things are done. We also follow through the supply chain monitoring, and also analyze utilization in this facility to be able to ensure that the items that come into those facilities are utilized appropriately and there's actually no out of stock. So then we also monitor the cold chain systems here to ensure that they meet with international standards. We also seek for alternative power management, because you know that without power, a lot of critical primary healthcare services cannot go on. So alternative power management also falls under this management system. So this is what the STREAM initiative that the Edo State government is using to create a sustainable primary health care system in Edo State. So, and beyond this is the funding for primary health care. Now, we heard the keynote speaker talk about the Basic Healthcare Provision Fund. We heard the Commissioner talk about government funding and donor funding. So, and we also heard him talk about the health insurance scheme. So, funding is is the underlying principle to all these things that I've mentioned now. Because without funding, we will not be able to carry out these things. But be it as it may, we now have these resources at our disposal. So it is left for us now, because Dr. Nabudele was part of those who ensured that this basic healthcare provision fund was available to funding primary healthcare services and healthcare services and insurance generally in the country. So these funds are available for us now. Primary healthcare facilities get this funding based on what we call quarterly business plans. So they have a business plans where they engage with community leaders, people we call the Ward Development Committee, Village Development Committees, to plan a business plan for the quarter. And funds are released to them based on approval of those business plans, and they utilize these funds to ensure that the smooth running of the facilities are in place. So with these few points that I made, I would like to just tell you that building a sustainable primary healthcare system is possible, and Edo State is championing that cause. I'm sure across the country, we may not get as many doctors that are currently in the Edo State Primary Healthcare Development Agency as in many other states, and that's because the incentives are there. The incentives are there. We are not as in 100% yet, but we are moving at a fast rate. That in the next couple of years, if this trajectory is continued, I can bet the fact that our tertiary health institutions and secondary health institutions will hardly see the kind of volume that they are currently seeing now, because all our primary healthcare facilities will be fully utilized, and our people will understand that they can get very good healthcare in those places. Thank you very much.
Please, a round of applause for our guest speaker. So we are gradually coming to the end of today's event, and before we draw the curtain close, I would just like to encourage each and every one of us who have listened from the beginning and up to this point that our lecturers are still very much here and will be willing to take our questions and concerns concerning the lectures that have been delivered so far. Let's take the opportunity to get very detailed information as concerning our theme for today and the topics being discussed. Okay, before we proceed, I would just also want to recognize a few other persons who have walked in during the course of the program. You have Emmanuel Ikpefuna, the President Nnamdi Azikiwe University Medical Students Association. Please, if you're here, you're welcome and duly recognized. We have Nelson Fade Latte, representing the President, Port Harcourt University Medical Students Association. You are also duly recognized as well. We would also want to recognize some invitees from the University of Benin Medical Students Association. We have Comrade Caesar and Cesaro Eborime from the University of Benin Medical Students Association. You're all welcome and duly recognized. Okay. Moving on, I would like to call on the NIMSA Vice President External. If you're here, please come for his speech and remark for this event. You're welcome. Please, a round of applause for him.
Good afternoon to all the important delegates here today. I'll be starting the existing protocol to once again welcome you to this wonderful weekend. We hope that the proceeds of this event would stay us as an administration for this coming year, and we would like to appreciate our speakers for today for imparting us with knowledge on very, very key health issues, and we believe that the knowledge that we have gotten here would empower us to find solutions to these problems, especially that of universal health coverage. So we do appreciate you, and we appreciate the knowledge you have imparted. So to the members of the National Executive Council, we are gathered here to create solutions to make pathways for a successful administration, and we thank you for coming here. I know people have come from different parts of the country to be here today, and we appreciate that greatly. And we would just like to say that you are welcome, and I'm wishing everyone a happy and wonderful weekend, and may we all have better direction by the time that Sunday comes. To the rest of the guests, say thank you very much for honoring our invitation. We appreciate your presence and your time, and thank you very much for being here. So we'll still have a couple more events, and we would enjoy everyone to come in and then let us proceed with the event so we can wrap up today. So apart from that, thank you very much everyone for coming, and we hope you enjoy the rest of the day. Thank you very much.
A round of applause for Vice President External. Okay, one thing we particularly enjoy and celebrate here at the University of Benin is the fact that we have our past leaders continuously supporting and encouraging us, coming up and mentoring us. And as you can see evident here today, a lot of them have been here to ensure that we had a very smooth, successful opening ceremony today. While the Vice President External was speaking, we had one of them also here. Please join me with a round and sound of applause. Welcome Dr. Ilobe Inusu, the Deputy Secretary of the NEC here present today. Thank you so much, sir, for gracing us with your presence. Before we close, we have just about two items left on our agenda. I would like to call on the NIMSA Secretary General. We have a couple of persons, sponsors and brands who also contributed to this program, and he'll be here to itemize, to list them and then show some form of appreciation to them. Please welcome the Secretary General, Fortune Olayi.
All right, good afternoon, everyone. Before I proceed, distinguished guests, ladies and gentlemen, invited individuals, special guests of honor, Dr. Osama Abdullah, WEMA President, immediate past, our esteemed keynote speaker, Dr. Mrs. Philip Mbureme, the immediate past NMA Chairman, Dr. Harrison, as well as other guests invited. I am honored to stand before you as the National Secretary General of the Forces Administration of the Nigerian Medical Science Association, an organization that is steeped in tradition and excellence. We are obviously aware of the economic challenges facing our beloved nation, Nigeria. So putting this event together was very challenging. But these challenges were nullified by the generosity and philanthropic efforts of our distinguished sponsors. I would like to kickstart this association of sponsors by thanking the father and mentor of many in the past of medicine, the lion killer himself, Dr. Osama Abdullah, the immediate past world medical association president. You know, initially, I thought Dr. Osama Abdullah was just a man who was eulogized for his intellectual discipline solely. But then I realized that his tremendous intellectual discipline, as well as his political instinct, was matched by a disciplined force of spirit. Mastery was not a slave to government reforms. If you have a lot of leader is speaking a lot on government reforms lately, and they're always in sure to follow up on every speech he makes. And an unflinching commitment to collective works on behalf of the rest of the 10 million. So So you guys should tell me the because I'm going to do this for you. Alright. Also, there is something that is normally said, or in statements that is normally made by somebody in medical school. And he normally says that if men were worshipped as gods among their fellow men, then Professor Friday Okunofa would definitely occupy the highest echelon. This event is commonly made by a lot of medical students in medical school. Professor Friday Okunofa is the chairman for the Center of Excellence in Reproductive Health Innovation, SEHI, University of Benin. And honestly, Friday Okunofa embodies an angelic figure among all of us. Categorically speaking, Professor Friday Okunofa was extremely instrumental in our victory in Kano State, and he has not stopped supporting us throughout, financially, based on our advice, and every other way. Professor Friday Okunofa has always been supporting us. So wholeheartedly, we extend our gratitude to him. He couldn't make it for the opening ceremony because he had some events to attend in Abuja. Next, I would wish to express our profound appreciation to another professor, Professor Godwin Bazwaye, Chief Medical Director of Nigerian University Teaching Hospital, and also the entire management of Nigerian University Teaching Hospital, Okada.
Professor Bazwaye's pioneering work in stem cell transplant treatment has revolutionized medical practice in Edo State, Nigeria, and sub-Saharan Africa. He's one of the most brilliant minds anyone will ever cross paths with, both administratively and academically. Thank you very much, sir, for your support and warm reception. We do hope that those from the University send our gratitude to him. Furthermore, we extend our appreciation to Dr. Mrs. Ebreme Oike, Dean of Clinical Sciences, and the entire management of the University College of Medicine. Your invaluable support and guidance have prepared us towards the realization of this project. I remember when we arrived at Okada, the warm reception we received was both the dean and provost was very happy. So we thank them a lot. Also the enforcement man in the best of the management system that whenever we knock on his doors, he's always ready to answer us. And this man is the Deputy Vice Chancellor of Academics, Professor Ray Ozolwa. He has been very, very instrumental to us. In fact, Professor Ray Ozolwa has been someone that has fast-tracked anything we need. We could need a bus in the next 2 minutes that will take us to Anambra, and Professor Ray Ozolwa will get it done for us. That is the amount of support that we have been getting from him. As our DVC academics, he has not only worked tirelessly to improve the academic price of medical students, but he has also been a beacon of support for us in the Nigerian Medical Students Association space. Thank you very much, sir, and also thank the entire management of the University of Benin, especially the Vice Chancellor, Professor Linda Salami. To our dynamic Professor Wilsons, that is the Dean of Medicine, Professor Wilson Sarabiago, and the Dean of and Provost of College of Medical Sciences, Professor Wilson Sado, our daddies. We cannot appreciate you both enough for your tremendous support for us, not just as medical students, but as potential administrators in the medical space and beyond. Thank you very much, daddies. We really appreciate it. Also to the various organizations such as 7up Company Limited, Better Face Medical Science Centers, and 360 Entertainment, we extend our heartfelt appreciation for your invaluable contribution. Sadly, time does not permit me to continue, but to other remarkable individuals, especially individuals like the Edo State Governor, who just surprised us and are raising some of amounts that will help us out a lot in our administration. We thank everyone for their appreciation. May the Almighty bless us all. Thank you very much. I remain Olai Fortune, the Secretary General of the 47th Administration of our movement.
Okay, I particularly also want to appreciate every one of us present here for waiting up until this time. We are sincerely grateful for your time and patience. We'll be drawing this meeting to a close shortly, but before then, one of the students here present has a question. Thank you from University of Ibadan.
Good afternoon, dignitaries. Good afternoon, NIMSA. Good afternoon, members of the National Executive Council. My name is Tanitolu Akola Akola, a member of the NEC, serving as the Director for Climate Awareness and Advocacy Programs. Today, my question is about climate awareness and advocacy. My question is based on the topic why we all gathered here and why we listen to you speak so eloquently. We know that every Nigerian family is bearing two life-debilitating sicknesses away from extreme poverty. We know that many families live, go to church, pray that their loved ones don't get sick. Because of getting back, because of recovering from sickness, can plunge the entire family into sickness themselves. However, I have seen, like you mentioned, that a lot of our expenditure comes from out of pocket, with numbers ranging as high as 97%. And we know that health insurance proves to be the key to ensuring that the individual funds that comes from each of our pockets can be pulled together, can be used to revive our health sector, can be used to ensure that quality care can be given at prices that are affordable to everyone, thus driving the function and the aim of primary health care. Now, these things seem like something that can happen, something that if effort is put into place, it can become a possibility. The very first NIMSA event I attended was in Ilorin, and the theme was health insurance. The first NEC meeting I attended was in Calabar last year, and we were talking about primary health insurance. One of my friends spoke about primary health care, and he spoke about instituting strategies to bring healthcare closer home. Now, my question is about health financing and how we can bring it closer home. How can we learn? I know people who travel distances, who travel who use major roads to come to the University of Ilorin Teaching Hospital to assess the pristine level of care we give them. But we can pull the money together. We can use it on this primary health care skill. So I'm asking now, I hope I have not used too many words to scatter my point. And I hope you can pick up what I'm saying. I have to look after it. But yes, now, what are the challenges that we face in ensuring that health insurance comes home? And why is it that pulling together of these funds seems to be an arduous task, seems to be a journey that we are still trying to get ourselves onto? Thank you.
Thank you very much. Any other question? I should just answer it. Health insurance can be taken to your doorstep if you are ready to embrace health insurance. But every state should be ready, first and foremost, to ensure that they have a law. And most of the states that have laws, they are also able to access what we call the basic health provision form. Because that is a criterion for you to be able to access that, because that is still a law that sets on state health insurance provision. Then you can even break that down to have community health insurance, whereby you now have a group of people in the community that can now bring their money together and also put it into health insurance services, so that anytime they need care, they can access this. But one of the challenges we are having is awareness. The awareness is not really well established, but I know, like in Edo State, they are doing their best to ensure that people enroll into the state health insurance commission. Then, but for the community health insurance, I don't think they have started it. But if they are able to start it, they will be able to access it. And once you register with any of the state health insurance, you don't need to go to UBTH to be your provider. You will get a closer health facility who is also accredited, because you must be accredited by the State Health Insurance Commission to be able to carry out primary care. So when you have those accredited, even private health facilities, they are accredited to carry out this care. So you don't need to go to maybe somebody who lives at Auchi coming to UBTH to access health insurance. You can access health insurance in the general hospital there. You can access it in the primary health care centers and some private health facilities. So I don't know if I answered your question.
Thank you so very much, ma'am, for your succinct reply. We have eventually come to the end of today's opening ceremony, and to end this, please join me welcome the NOC chairman for today's program and the NEC meeting in particular, Osarugwe Minoba, for her closing remarks. Please a round of applause for her.
All protocols duly observed. I would like to start this thank you appreciation speech by, first of all, thanking the 47th President, Moses Oyinbo. Thank you very much. I don't know what you saw in me, but you picked me. And due to your support, well, the program has been going on fine. I want to say very, very big thank you to you. To all my team members, from feeding to logistics to programs, you know, everything. I would like to say a very big thank you. You all have made me shine. Moses is always thanking me because, you know, everything is going on well. I'd like to say thank you to my team members because without you all, I won't be able to shine like this. To every name site here in Benin, I would like to say welcome. Please enjoy your stay here. We are going to make it really memorable for you. To everyone I met, you know, this is my first NIMSA activity. And chair, it's well, meeting persons, well, it has been nice. Like yesterday arrival, I met so many persons from across the country. I would like to say welcome. Don't worry, you enjoy your stay here. I see you. So thank you very much. Thank you very much. Thank you. Thank you.
Let's give a round of applause for her. We have come to the close of this meeting now. I hope we had a wonderful time. Did we? Did we have a wonderful time? Great. All right. We cannot close this meeting without recognizing the caretaker committee of the University of Benin Medical Students Association, my country, represented by Enwezo McLean. Please let's give a round of applause. Once again, I will remind you that we are patriots and we're going to sing the second stanza of the national anthem. I told you I couldn't remember the first one. I don't think I have any idea of how the second one goes. So we're going to sing that again. So everyone please rise as we take the second stanza of the national anthem. Okay, so we're going to sing without the music. All right. 1, 2, please, hands by your side, hands by your side. 1, 2, go. pledge Nigerian flag. Alright, we're going to take the closing prayer. In Jesus' name. Is there any Muslim? Yes. Okay, please. To take the closing prayer for us. A Muslim student. Is there any Muslim students to take the closing prayer?
صلوا على النبي الكريم اللهم صل على محمد وعلى ال محمد كما صليت على ابراهيم وعلى ال ابراهيم في العالمين انك حميد مجيد اللهم بارك على محمد وعلى ال محمد كما باركت على ابراهيم وعلى ال ابراهيم في العالمين انك حميد مجيد